needing help, but actually not willing to do the work or just be kind of self-aware.
Okay, yeah, that's a common question. That's, in fact, one of the most common questions I hear. Basically, what he's saying is, how do you help a family member, somebody close, intimate, in a family setting, where they have dysfunction, they're suffering, they say they want to the help, but they're not applying or doing anything when offered. Is that correct?
Yeah.
Okay. Um, couple rules of behavior that we have to understand first, especially when it comes to this. And there'll be some concepts that I'll give you. Okay, so I'm going to kind of summarize and generalize it because we're short on time for the purpose of this lecture. When we talk about having somebody in the family with dysfunction, usually it is starts with anxiety and depression, either or, most likely always anxiety. That anxiety, if unresolved, will turn inward and that person will become depressed, a little more hopeless, lethargic, etc., and lack of productivity. And then when that persists without inner intervention or resolve, then that person could almost go into the next stage of anxiety, which would be panic attacks, where they become more debilitated, unable, social anxiety, etc., where it starts to impair their functioning significantly in their activities of daily living. If that goes unresolved, you can get into some serious chemical imbalances in the brain that could lead to like a cyclothymic type depression, or bipolar. You hear that one often. That's where you have real high highs, euphoria, and unrealistic reality, as well as real low lows, like wanting to commit suicide or super sad, unable to function. If that goes unresolved, then you get into schizoaffective type disorders, where you start to lose track of reality, you start to hear things, see things, delusions, etc. It's a progressive state of being. If anxiety is unresolved or persistent over time, there's consequences to that, and the symptomology will become progressive. It will get worse, and you will have more and more dysfunction until it debilitates you. So, most people counter that, especially in families, with substance abuse. Is that correct?
Yeah.
Okay. I know that because that's just the next progression up in not wanting to deal with or resolve those issues. First things first, let's talk about, is it fun or is it feel good to talk about issues that you have personally that have come from abuse or neglect or insecurity, vulnerability, pain and suffering and anguish? No, I don't know anybody that goes around and volunteers that information and talks about it regularly because it's very painful. So there's a biology, a neurobiology to the brain that requires the brain for your survival to avoid pain and seek pleasure. It's the pleasure principle, but it's the fight or flight response as well. People call it different things. Basically, what happens is your cognitive capacities don't allow you to think and reminisce about those horrible, terrible things because it's very painful. So the brain, in protection of itself, will distort your reality. It will distort your perceptions of what happened, how it happened, who's at fault, what locus of control, and so on, external or internal. And it will temporarily sedate the pain and the anguish of that. To realize that those things have happened and to deal with them takes a concerted effort, as well as you would need support. Most people don't have the coping capacities to deal with that. Clearly, if they were raised in a situation where they were abused or neglected or lacking coping skills, it's because of that. So where are they going to get those things to be able to deal with that stuff if they don't have them? So that would be unbelievably painful. And people obviously would avoid that at all costs. Does that make sense? So for one, you have a built-in distortion of reality for those people who have dysfunction. Do people with dysfunction know that they have dysfunction most of the time or initially?
No.
No, absolutely not. They think they're doing great because of that distortion of reality, or in this case, their perceptions of reality for them. So that in and of itself is problematic. So in order for that person to really truly understand that they have a dysfunction, what would usually need to occur? What's the universal wake up?
Something traumatic.
Consequences. Something bad happens. Maybe they get a DUI. Maybe they get in an accident, hurt themselves. Maybe they lose their job. Maybe a significant relationship that was toxic ends, and so on and so forth. Or some type of intervention from family members, and it's usually law enforcement. That's the vast majority of the wake-up call for dysfunction is when people get involved with law enforcement, domestic violence, get their kids taken away, drug court, et cetera, et cetera, et cetera. Okay, so that distorted reality is difficult to challenge until there's consequences. Now, why is it difficult? Well, because that person in the family is most likely been catered to, or the word that most people use is enabled. Okay, does anybody know what enabled means? Enabling? You hear it as a catchphrase, it's pop psych and so on, but there's a true operational definition of it. It's when you don't allow consequences to happen to a person who's engaged in dysfunctional, aberrant behaviors. If aberrant behaviors go unpunished, what will continue to happen?
The same
The
behavior.
same behaviors. And will they get less or worse over time?
Worse.
Worse. Again, it's progressive. So that's an important part. Now,